6 dangerous side effects of amlodipine you should never ignore. What if the pill you or someone you love takes every single day, the pill trusted by over 70 million people worldwide, was silently preparing your body for a medical emergency? I'm talking about amlodipine. It's prescribed in every corner of the world, often given as a first choice for high blood pressure and heart disease. Doctors trust it. Patients rely on it. Pharmacies sell it by the millions. But here's what most people don't know. While amlodipine is safe for the majority, it carries with it 6 rare but extremely dangerous side effects that can turn deadly if ignored. Now, you've probably heard of the common side effects: swollen ankles, dizziness, flushing. But this video is not about those mild inconveniences. This video is about the critical warning signs your body might already be sending you, the ones hidden deep in medical journals, the ones most patients never hear about until it's too late. So let's dive in. Disclaimer: this video is for informational purposes only. It's not medical advice. Always talk to your doctor before making any changes to your medication. Brash syndrome. Have you ever seen a row of dominoes fall? One pushes the next, and suddenly the entire chain collapses. That's how Brash syndrome works. It's an acronym: bradycardia, slow heartbeat; renal failure, kidney shutdown; AV node blockade, heart's electrical delay; shock, low blood flow, organ failure; hyperkalemia, dangerously high potassium. Here's how the deadly cycle starts. Your kidneys stop filtering potassium properly. Potassium rises in your blood. That high potassium slows your heart down. A slower heart pumps less blood to your kidneys, making them worse. The AV node that controls your heartbeat gets blocked. You collapse into shock. Real patient cases. An 89-year-old woman, documented in the Canadian Journal of Emergency Medicine, developed Brash after being dehydrated. Within hours, she was in cardiogenic shock, her heart barely beating. Another study found a 5.7% death rate, with up to 20% of patients needing dialysis and 33% requiring pacemakers. And here's the scary part: most people, including doctors, don't immediately recognize Brash. The symptoms look like heart failure or kidney disease, when in reality, it's both happening at the same time. Warning signs to watch for: sudden extreme fatigue, slow pulse under 60, swelling, confusion, or fainting. Gingival hyperplasia. Now, not every side effect is about organs shutting down. Some are about quality of life. Imagine your smile slowly disappearing behind swollen gums. This is gingival hyperplasia, abnormal gum overgrowth caused by amlodipine. It affects up to 3% of users, but that still means thousands of people worldwide. Here's the twist: it can happen at just 5 milligrams daily. It usually appears within 3 to 6 months. Men are 3.3 times more likely than women to get it. Why does this happen? Research shows amlodipine triggers certain growth factors in gum tissue, leading to excess collagen and swelling. Real impacts: patients struggling to chew properly, difficulty speaking, constant bleeding while brushing teeth, and in some cases, surgery, gingivectomy, is the only option. Even worse, sometimes the overgrowth doesn't fully go away even after stopping the drug, meaning permanent changes. Warning signs: swollen gums, difficulty cleaning teeth, gum tissue creeping between teeth. Acute kidney injury. We usually think amlodipine helps the kidneys by lowering blood pressure. And in normal doses, it does. But in overdose situations or bad combinations, it can do the exact opposite. This is called acute kidney injury, aka a sudden loss of kidney function. Symptoms: drastically reduced urine output, less than 400 milliliters per day. Swelling in ankles and legs. Confusion, nausea, and extreme fatigue. Case reports: In European Journal of Clinical Pharmacology, patients who overdosed on amlodipine developed severe kidney failure, some requiring weeks of dialysis. In others, kidney function never returned to normal. Mechanism? When blood pressure falls too low, kidneys don't get enough blood supply. Without that pressure, the tiny filters called nephrons stop working. Warning signs: sudden drop in urine, swelling, or dark-colored urine. Stevens-Johnson syndrome. Now we enter one of the most feared reactions in medicine: Stevens-Johnson syndrome, SJS. It often starts mild, like the flu. Fever, sore throat, red eyes. Patients think it's nothing. But within days, red patches turn into blisters. Skin peels away in sheets. Pain becomes unbearable. Statistics: 7.1 cases per million prescriptions. Rare, yes, but devastating. 5 to 10% mortality for SJS. Up to 50% mortality for its severe form, toxic epidermal necrolysis. Why deadly? Skin is your body's shield. When it peels off, you lose fluid rapidly. Bacteria enter through open wounds, leading to sepsis. Organs start failing. Patients are often treated like burn victims. For fluids, sterile environments, pain control, and antibiotics. Warning signs: sudden fever with painful rash, blistering around mouth or eyes, or painful red skin. Thrombocytopenia. Now imagine this: you bump your arm lightly against a door, and the next day you've got a giant purple bruise. That's thrombocytopenia, dangerously low platelets. Normal platelet count? 150,000 to 450,000. But in rare cases with amlodipine, patients crash to just 1,000 platelets. Mechanism? Your immune system starts producing antibodies against your own platelets, destroying them as if they were enemies. Symptoms: nosebleeds that won't stop. Tiny red or purple dots on skin, petechiae. Overwhelming fatigue. Case studies show thrombocytopenia can start within just 48 hours of overdose and last for days due to amlodipine's long half-life, 30 to 50 hours. Warning signs: unexplained bruises, bleeding gums, pinpoint red spots, or fatigue. Conclusion. So let's recap the 6 dangerous side effects of amlodipine. 1. Brash syndrome, a deadly cycle of heart, kidney, and electrolyte collapse. 2. Gingival hyperplasia, gums growing uncontrollably, often requiring surgery. 3. Acute kidney injury, sudden kidney shutdown, sometimes permanent. 4. Stevens-Johnson syndrome, rare but deadly skin reaction. 5. Thrombocytopenia, platelets crash, bleeding risk skyrockets. 6. Angioedema, rapid swelling that can block your airway in minutes. Most people on amlodipine will never face these problems. For millions, it's safe and effective, but for a small fraction, these complications can be devastating. So don't panic, but stay informed. Know the signs. If something feels off, talk to your doctor immediately. Comment below: did you know about these rare side effects before watching this video? Give this video a like if you found it helpful. Subscribe for more life-saving health content. Stay safe, stay informed, and I'll see you in the next video.